everybody. Welcome to Pick Dr. Osborne's Brain. We got a great show for you today. We're going to be taking all of your questions, toughest nutritional questions. Predominantly, we're going to focus on vitamin B1. If you've got additional questions beyond that, pipe them in and I'll get to as many as I can over the course of the next hour. And don't forget to take advantage of our special sale. Of course, our sponsor being Gluten Free Society. This week, you can save big on Warrior Bread. Just use promo code THANKS when you go to check out. That's promo code THANKS, and that saves you big time on Warrior Bread. So many of you have great rave reviews over the bread mix itself. And of course, we've created versatile recipes for you to follow. And everything from crust on a pie, like a pumpkin pie crust, to dinner rolls, to flatbreads, to just old-fashioned sandwich bread. If you're missing or craving that, you can use that promo code. Just go to Gluten Free Society, type in thanks when you go to checkout to save. Okay, let's dive in to the questions. So we've got quite a few that have already come in. And so here we go. Let's just dive right in. Is B1 responsible for glucose absorption? No, B1 is not responsible for glucose absorption because glucose absorption occurs in the GI tract. But what B1 is responsible for doing around glucose is helping to, once glucose is absorbed from the gut, and understand you break down carbohydrates, and one of the final carbohydrate pathways is glucose. That gets absorbed through the gut into the bloodstream. Once it's in the bloodstream, then that glucose has to be absorbed into the cell. Once it gets into the cell, that's where B1 really plays the major biochemical role. It helps break glucose down into smaller and smaller bits, releasing hydrogen, which is what allows for the generation of ATP or energy. So it's not that a deficiency of B1 per se is going to cause malabsorption in the GI tract, although severe enough B1 deficiency can disrupt how the GI tract functions, but it's really the utilization of glucose inside the cell to convert it into energy that is B1's major role. Let's see here. Can a B1 deficiency manifest in animals like cats, dogs, or horses? Yes, it can. I'm a farmer, kind of, right? I put my farmer hat on sometimes when I have a farm that I live on with cows, pigs, dogs, no horses, but cats and ducks and geese and chickens. And it's very interesting how much correlation there is in terms of vitamin and mineral deficiencies in animals as well, but it definitely can manifest in animals. So if if you have that concern, one of the best things that I would suggest that you do, because I'm not a vet, but would be to talk to your vet about potentially being able to test your pet for nutritional deficiencies as a standard course, should there be an illness. I mean, I would look at animals the same way I look at humans, and as a matter of fact, over the past 4 years or so being on a farm, I have been, we'll just say, sourly disappointed in the skill set of veterinarians to really address nutrition, right? Because we've had different vets come out to look at some of our animals from time to time, and ultimately what's always happened in our case, and again, this is my own personal anecdote, is the vets want to prescribe drugs, but I want them to look at nutrition, and then we have an impasse and they don't really look at nutrition. And so then I go to veterinarian textbooks and read and research about my animals and find that a lot of times if we just supplement our animals properly and appropriately, a lot of the problems that they face out on the farm are overcome. So if that's helpful for you, Ben. One, I don't know if this is a question, maybe a comment, but I'll comment on it. Experts suggest that thiamine deficiency or B1 deficiency may produce riboflavin deficiency, and that's definitely true. Another comment on, will carbs deplete vitamin B1? Yes, excessive carbohydrate consumption can definitely deplete vitamin B1, especially if the carbohydrate that you're consuming is an empty carbohydrate or an empty calorie, something like alcohol, or alcohol's got a lot of sugar in it, especially today's modern alcohols with all the fruit flavors and everything else. And then you also have empty carbohydrates in the form of highly processed sugar-based products, grains, and other processed packaged food items that are heavy carbohydrate. Let's see here. Not sure I understand what you're trying to ask in that question. I like this comment though. So it's sad that warnings do not accompany medications that are known to deplete or block certain vitamins or minerals. It's very sad. It's really, even in my opinion, it's more sad that the doctors don't have that conversation as part of the risk benefit of using the meds with their patients. It's very, very rare that a doctor will go down that road with a patient because they're just not trained in nutrition. Can vitamin B1 help relieve Meniere's disease and associated vertigo? It can, Zilly, if the B1 deficiency is what's causing it. So again, there are many different reasons a person can develop Meniere's or vertigo. Certainly vitamin B1 can affect neurological function and contribute to that. So if the deficiency is what's causing it, yes, I would say yes. But this goes back to testing, right? Testing is always the best approach to evaluate whether or not you have a deficiency. And for vitamin B1, there's different ways to test for B1. Plasma, not a good way. Serum, not a good measurement of vitamin B1 status. There is a test called erythrocyte transketolase activity coefficient, or ETKAC. That's a test that if you got a really sharp GP, they would look it up for you and potentially order it for you. But that's one way that you can look at it. But in my opinion, really the best way to look at it is lymphocyte response or lymphocyte proliferation. That's a much more accurate way to go in and look to see whether or not somebody has a low level. I like some of these comments from Tuesday's show. I don't want to be a politician, so those of you who ask me to run for president or volunteer to be the head of HHS, Human Health Services, no thank you. I've been fired from every job I've ever held for good reason. I always question the leadership, and not in a negative way or not in a descending way, but more just in a, is this the best approach? Is this the most intelligent way to do it? As many of you have probably experienced within your own lives, a lot of times when you work in an environment, if you're doing something, you generally are the best in that position because you do it every day, and so you could make probably some of the best commentary on how that job should be done. But a lot of times the boss or the person over you will come down and say, I want it done this way, for no apparent reason other than they just want it done that way, even though that way isn't efficient and it isn't the best way to do it. So it's a pretty frustrating endeavor, and that's why I've been fired from every job I've ever held down. B1, can B1 help with tinnitus? Again, going back to the same question with vertigo and Meniere's, if B1 is contributing to it, then yes. Okay, let's go over to the right side. Dennis is asking, Dr. Osborne, my dietitian said that eggs contain no nutrition except for protein. Do you agree with that? No, fire your dietitian and run as far away from him or her as you possibly can. Eggs are rich in a number of nutrients, including fat-soluble vitamins and water-soluble vitamins and choline. So, again, that would be, in my opinion, a nutritionist who's probably not qualified to sit across the table from you, just my opinion. How would you take CoQ10 and Ultra Q? So Russ is asking about CoQ10 Max, which is one of our products at Gluten Free Society, and Ultra Q, which is quercetin, at the same time. Divided doses are on different days. No, you could take them simultaneously together, and generally what I would say is if you're using them both, one capsule of each, you can take at the same time with food, and you could do that several times a day depending on what kind of dose you were trying to hit. So like if you were deficient in CoQ10, most people deficient in CoQ10, they need about 300 milligrams of CoQ10 a day to kind of overcome that deficiency. And then with quercetin, it's usually it's anywhere from 1 to 5 grams a day, just depending on what you're trying to do and what you're trying to accomplish. Do B vitamins curtail mosquitoes? There's some anecdotal research that shows that vitamin B1 specifically is a deterrent for mosquitoes biting you, and I have seen that to be true clinically. living in the greater Houston area where mosquitoes are not an uncommon phenomena. In my patient load and my patient base where we give them B vitamins, and so a lot of times when their B vitamin levels are nice and saturated, one of the pieces of feedback that we get is that mosquitoes used to love my blood, now they don't so much. What is the maximum dose of vitamin B1? It's different for different people. I wouldn't say I'd say first of all, if you're going over, 300 milligrams a day, depending on the form, you probably want to get your levels tested and be working with an expert so that you don't end up creating a problem. Now, that being said, B vitamins are very safe. They're water soluble. They have a relatively short half-life, so you can take higher doses and they don't tend to cause side effects. And B1, I've never seen a person have a B1 toxicity effect, and I'm using doses anywhere from 20 milligrams all the way up to 300 milligrams on a daily basis. But as far as the maximum load, I don't think anybody knows. I think that number would be different per the person, but I think if you're getting up over that, in my experience, I won't go 300 in a person unless I'm testing them regularly, so that I don't, one, spend more of their money on supplements than what's necessary, but two, there's always a risk of a potential overdose. And again, everybody's a little unique in that regard. So I like to play caution as a baseline, right? And again, not that I'm trying to warn or scare anybody away from B1, because how many reports of death by B1 are there? None. How many reports of hospitalizations from overdose of B1 are there? None. So it's not like aspirin, where, over-the-counter aspirin, where 13,000 people died last year from proper utilization of it. So B1, again, pretty safe. But still, if you're trying to be conservative, it's good to work with somebody to know how much, for how long, is too much for you as a unique person. Let's see, what's my opinion on insulin, IV insulin? I mean, why would you be using it in that way? I think my opinion on it is going to be dependent upon what is the reasoning behind why a person would be getting that recommendation from their doctor. If we're talking about a type 1 diabetic or something along that regard, that's a little bit different. But if we're talking about a diabetic that's just type 2 diabetes out of control, there are ways around that. There are ways to resolve that naturally with diet, with nutrition changes, with lifestyle changes. And so I'm less of a fan of medical intervention when there's a lifestyle or diet intervention that works better without side effects. But it just depends on what your situation is. Let's see here. Hareem, I love B vitamins, but I feel too stimulated or going in and out of zoning out too much. I love what it does to my nerves, but don't like how it feels for my brain sometimes. Am I taking too much? Probably. What I would look, if you feel really good taking them, but it almost like stimulates you too great, then I would look at backing down on your dose and see if you still feel that benefit without that overstimulus. How accurate is lymphocyte test for thiamine? Very accurate, extremely accurate. Are there any marshmallows that you know of that are made without corn syrup? Yeah, the homemade kind. You can make marshmallows with tapioca instead, but you got to make them at home, and they're not going to be what you kind of buy in the grocery store that you might be accustomed to. You can get them pretty close. We've done that, when my kids were small. My wife made them, for camping trips, and they did pretty well, but they weren't exactly the same texture consistency that you have the things you might buy in the grocery store. As far as black jelly beans, a safe version, I can't tell you because I don't really eat candy. If you miss black jelly beans, I would say, one, you're probably not going to find them without some kind of sugar, and maybe if you can find them with just pure organic cane sugar, would be a better option than, say, genetically modified corn sugar with glyphosate. That being said, it's still not a healthy food to eat, so it kind of fails the number one cardinal rule of nutrition, which is you can't get healthy eating food that's not healthy. Now, everybody's going to have a treat at some point in their life at some time. So, I won't, I'm not judging you for that, but I can't recall a brand per se that I would dive into. Okay. Let's see, Mario, high doc question. Cramps that subsided after a 5-day course of 300 milligrams of magnesium and potassium, but now tingling in legs and feet is present. Can this be linked to too much potassium? Not at 300 milligrams. I mean, you can eat a banana and you're going to get way more than 300 milligrams of potassium. So probably not too much potassium causing that. You might have another problem. You could have, neuropathy caused by, B1 deficiency could do that, tingling in the legs and feet. B5 deficiency, B12 deficiency can do that. B6 deficiency can do that. Lipoic acid deficiency can do that. I mean, there are a number of different nutrient deficits that can contribute to the deterioration of nerves leading to neuropathy. And so, again, it's probably not, not at 300 milligrams. You're not overdoing potassium. You could eat a big healthy green salad and you're going to get more potassium in that. So I would definitely say not probably a cause in terms of magnesium and potassium. Why does the medical system say that beriberi no longer exists when it clearly does? They treat symptoms instead of testing for and addressing. Well, they say it because they don't measure it, right? I mean, when you read the medical textbooks that say beriberi is a third world disorder, and that's what they teach you in medical school, then you go out and practice, and that's what you say to your patients. But that means, basically what they're doing is they're accepting knowledge given to them without question. And that, to me, that's the opposite of doctoring. I mean, the knowledge that we learn in our graduate programs and training, understand, is a baseline of minimum knowledge. So when a doctor graduates and receives their diploma, what that diploma means is that they've received a minimal level of education that meets the criteria to be called whatever doctor they are, whether it's a medical doctor, chiropractor, naturopath, osteopath, dentist, etc. A minimum level being the key phrase. You don't learn what you learn in school and then you're done learning. And unfortunately, that's the way many doctors approach practice, is they learn what they're going to learn. Yeah, they take continuing credit education hours every year. I mean, I know as to keep my license, I have to have 18 hours a year of continuing credit, which I more than fulfill just on my own in my own personal research and endeavors. But even through formal postgraduate work, generally usually get about 18 to 20 hours a year. But 20 to 18 hours a year that you actually are getting that you can apply, as opposed to 20 hours a year that maybe was taught by a pharmaceutical rep at a conference that was sponsored by, fill in the name pharmaceutical company, which, again, then you have to question the bias of the information and whether or not, it's accurate. But a lot of doctors, their learning stops after graduation for the most part. And I shouldn't say that, maybe I'm coming down too hard on them, but their learning in terms of nutrition definitely stops. Now, their learning in terms of using drugs and experience that comes with using drugs probably doesn't stop and probably continues to grow. But just because you say something doesn't exist doesn't mean it doesn't exist. And beriberi is a perfect example of that. And there have been a number of research studies where they took hospital patients who had congestive heart failure, who had been on diuretics for long periods of time, and measured them for vitamin B1 deficiency. And I can't remember, don't quote me on the exact number, but some studies were finding more than 50% of congestive heart failure patients actually had thiamine deficiency or B1 deficiency. And that B1 deficiency was the cause of the congestive heart failure. And the cause of the B1 deficiency was the diuretics that these patients had been prescribed for years, for decades, to kind of manage or mitigate their blood pressure, which, by the way, blood pressure elevation is a diet choice. It's a lifestyle choice. So, no drug solves that problem, and the consequence of long-term drugging leads to new problems that recreate the same types of risks that the drugs were intended to treat, and so you end up chasing your tail. So anyway, I can't answer for them. I can only educate you guys so that you can hold them accountable, right, to their actions with you. And I think the more that we're educated and the more we share this information and the more people go to their doctor and demand nutritional care as a core part for the course, then I think we're going to see doctors understanding that it needs to be a part of what they focus on in their postgraduate training instead of just ignoring it and saying it doesn't exist and then, gaslighting everyone, because that's what we've had so far. Possible side effects of too much B1 supplementation. I've never seen any toxicity symptoms of vitamin B1, Paul, so can't really give you a great answer there. Do diabetics and those with CKD deplete, I assume you mean chronic kidney disease, deplete B1 faster than those who are not? Yes, they do. They burn through it faster, diabetics with uncontrolled blood sugar, because you burn through vitamin B1 to try to convert sugar into energy. So if you have an abundance of sugar, you're burning through it. Chronic kidney disease depletion can occur when the kidneys start to become leaky and you're spilling extra B1 out of the bloodstream faster than you're capable of using it. So my daughter's struggling with post-vax symptoms of vibrations, brain fog, extreme fatigue, etc. Would B1 help? I don't know if it would or if it wouldn't. Marie, I think more than anything, if that's the case, you really want to get her in and you want to have a full workup done, because I've seen a lot of cases like that where it was different for different people. As a matter of fact, I recently had a conversation with one of my clients, and he had kind of a similar reaction after the vax, only it also for him activated something called rheumatoid arthritis. So it induced a form of autoimmune rheumatoid arthritis in him. And so it took the better half of a year to get the arthritic pain under control, and it took the better half of 6 months to really start getting the energy to come back. But that was under very meticulous testing. So we were doing the testing to determine what he was lacking, what he needed, and what other triggers could be present within his choices that would continue to allow for the exacerbation of those side effects. While so again, we got really customized and really personalized, and I've seen many people like that after the vax, and you don't want to play around with it. You don't want to guess, because nerve damage can be tough to heal. It already takes a really long time. Nerves are some of the slowest tissue in the body to heal. So, the best thing you could do is just get her tested. Is POTS related to B1? Yes, it can be. It's not so much that B1 deficiency causes POTS as much as B1 deficiency can exacerbate the symptoms of POTS. For those of you that know what POTS is, it's a postural tachycardia syndrome, and anyway, it's very common in people with gluten sensitivity. And I would say the B vitamin more related to POTS, at least in my experience, is vitamin B12. Yeah, so Muhammad made a comment. My anxiety has gone since taking thiamine. Our docs only give us SSRIs, which don't work. Well, yeah, I mean, I've seen that be the case. Remember that you need, one of the primary functions of thiamine is the production of the neurotransmitter acetylcholine. Acetylcholine is the chemical we use that balances the autonomic nervous system, specifically sympathetic and parasympathetic. And if you don't have acetylcholine, you can definitely suffer with anxiety as one of the side effects. And that's kind of, think of it as a form of dry beriberi in a sense. It's because it's affecting your nervous system. Differences between food-based B vitamins and synthetic. It's in their production. I mean, a lot of the synthetic B vitamins they're not technically synthetic. They're actually derived through biochemistry using bacterial fermentation, versus a food-based version, which a food-based version is usually attached to other things. And then in that food, there's a lot of other nutrients. So it's not just the singular vitamin, going solo. It's a complex within the food. And I would always say that it's far better to get your nutrients from food than from pill bottles. But there are cases where, especially when a person's, struggling with chronic illness, autoimmune disease, where taking a higher dose beyond food becomes a necessity because their body needs more than what food is capable of providing. And there are a lot of reasons why that can happen. One of the biggest ones as it relates to gluten is gluten-induced intestinal damage. As that damage is done to the intestine, malabsorption can set in, and so the food, being consumed is not properly being broken down or digested. So if there's already malabsorption and already nutritional deficiency, you kind of get stuck in a catch-22, and this is where higher dose vitamins can play a huge role in somebody's recovery. So this is kind of a really long and complex question from MR. I have SIBO and maybe Candida. So, first of all, better clarity, I can give you a better answer. I have high B6 in my blood work, but 0 in my urine test. Now have been having sleep issues, told I have possible central apnea. Would vitamin B1 help with any of this? It's really too complex of a question. You could take B1, and if it helps, let us know. But there's more going on than just a singular B vitamin deficiency. As far as the high level of B6 in your blood work, it's probably a serum test that was run. I would validate that or confirm that with your doctor. Anybody that's taking a B complex or a multivitamin with strong amounts of vitamin B6 can have a higher B6 in their serum labs. That doesn't mean it's a toxic level. It just, blood can be adjusted up and down rather rapidly as a result of supplementing. And so it's not a good indicator of long-term adequacy or intracellular adequacy. Can B1 help with an overactive bladder? I have seen it help in overactive bladder, but again, it boils back down to, the fundamental question, is your overactive bladder at all being caused as a result of B1 being too low? Well, I have a video in the future about B5. For acetylcholine. I have a video about B5. You can go back and look in our archives. We've had many videos on B5. I think I did a crash course on that, I don't know, maybe a year or so ago. My kids all recently were sick with the flu, took them back for a follow-up. They were fine. Little the doctor knew I didn't give them antibiotics, just treated them as natural. Okay, no question. They're just a comment. Well, I'm glad you're confident in making great decisions for your children. After watching the latest video behind the headlines, I'm also vegetarian. I don't know where the question in that is, but I wouldn't hold too much faith in a lot of the rhetoric around the vegetarian diet. If you're a vegetarian and you're not getting adequate animal protein, you could end up harming yourself. Most vegetarians, if you're not genetically designed to be a vegetarian, and some people are, but most of them that aren't, it takes about 18 months, and then around that 18-month mark, health dramatically can deteriorate. So I would just encourage anybody who's on a vegetarian diet to just have follow-up with a good functional doc who will measure your nutritional status to make sure you're getting enough zinc and B12 and B6, to make sure you're getting enough methionine and other amino acids. There are very real risks involved with that diet if it's not the right diet for you. And really, honestly, I would encourage you to get testing to help you understand whether that diet is right for you or it isn't. Let's see. A good dose of vitamin B5 to overcome a deficiency. So B5 anywhere, 1,000 milligrams would be a good place to start. But again, if you're going to do that, I would follow that up with some intracellular testing. Because again, vitamin B5, although it can cause a burning foot neuropathy, so can other B vitamins. So you don't necessarily want to just take B5 if you're not certain that other B vitamins are also not playing a role. And as far as timing with neuropathy, I've seen neuropathy clean up, and depending on how long it's been there, the longer it's been there, the longer it takes. But if it's relatively new, I've seen neuropathies clean up in less than a few days. I've seen improvements start to happen in a few days, and then a reversal in a few months, again, depending on how long it's been there. Do I prefer cod liver oil or krill oil? Neither. I don't like cod liver oil for the fact that it's really, really high in vitamin A, and you know, over time, if you're taking it every day, can really affect your vitamin D. But I also don't like cod liver oil for omega-3 in that it's really high in DHA and not high at all in EPA. So what I see in a lot, and I can peg it every time when I get labs back on people, is their DHA is always like 5% or higher, and their EPA is like less than 1%, and that's an extreme imbalance, and we don't want that. We really want our EPA to be around a 2.5+%. And so cod liver oil doesn't do that and can't do that. Neither can krill oil. You'd be gobbing down krill oil and you will not get EPA up to an adequate level on a lab if we're actually monitoring and measuring the count. So what I really like better is I like a concentrated omega-3 with both EPA and DHA. If you're looking for a product in particular, I have something called Omega Max. And for those of you that don't have a gallbladder, I have another one called Ultra Omega, and the difference predominantly being the Ultra Omega has fat digesting enzyme in it to help you properly break it down and absorb it, because if you're missing a gallbladder, that can be a challenge. But that way you get enough EPA without a DHA storm. So it's not that DHA at high levels is bad for you. It's just that, again, cod liver oil just has nowhere near enough EPA. How long does it take for my intestine to heal from celiac? Sahil's asking. We have a link or a really comprehensive article, Sahil, that will help you, and a pretty lengthy conversation, a video that you can watch on how long it can take to heal, and I believe that's titled "How Long for Gluten to Be Out of My System." So Mel, if you can find that and throw that up for Sahil. Okay. Dal says, the gaslighting is absolutely out of control. Any way you can do a show on how to combat this? It's not a bad idea. I think the best way to combat gaslighting is to not allow it to happen to you. I mean, I think we can answer that question pretty quickly. If somebody's gaslighting, you walk away. You don't need that relationship with that person in your life. If the world is gaslighting you, you have, let's say you have the ability to participate or not. And so I just choose to not participate in a lot of that. But anyway, yeah, I mean, it is a problem, but remember, money talks. What's the old saying? Money talks, BS walks. So if somebody's BSing you, walk and take your money with you. And if enough of us do that, then that gaslighting aspect gets to go away. Getting B12 shots, 1 mil every 2 weeks for years, but intracellular B12 levels are still low. I'm not a fan of B12 shots, honestly. I have found that lozenges are more effective at elevating B12 than any intramuscular injection. So if you're using something like methylcobalamin, which is one of my products at Gluten Free Society, that's a 5,000 microgram lozenge. What I do with people in my practice is I put, somebody with a deficiency on 10,000 micrograms a day in divided doses. But the lozenge absorbs through the cheeks. And it's important to understand that, to inject into the muscle, it's got to be metabolized and processed by the muscle before it makes it into the bloodstream. Going through the cheeks, it can go right directly into the bloodstream, and that's why I like that mechanism. Because many people with a history of gluten sensitivity or celiac disease have a damaged lining in their stomach, so their ability to produce intrinsic factor, which is required for B12 absorption, has been damaged, and so it can be a rate-limiting factor for that. And that's, in a sense, not technically, but many people that get diagnosed with pernicious anemia actually have gluten sensitivity, and they just don't know because their doctors aren't putting 2 and 2 together. But I would do lozenge over an injection. Let's see here. Lost 11 kilograms because of celiac disease. I'm on a gluten-free diet. How many months my body will start to heal? Again, that article, we'll put that up for you, but I think ultimately you got to make sure you're following the gluten-free diet in the proper way. If you don't know the definition of true gluten-free versus traditional gluten-free, you won't heal. 92% of you won't. So to heal, the other thing I would encourage you to do is read No Grain, No Pain. You can go check it out at a library, or you can pick it up on Amazon or any major book retailer. Or you can watch our Glutenology Masterclass. That's another thing that you can do if you really want to get educated about gluten. And the Glutenology Masterclass is absolutely free. Any of you can register or sign up. We can put a link into the feed for that registration. I think it's glutenology.net/registration is the URL for that. Why do experts always say that supplements are expensive urine waste of money? Because they're well, you know, I could see that you have experts in quotations, in quotes and air quotes, right? So experts aren't experts. Remember that the people that are saying that they don't have any experience with it. Two, they don't have the educational background to make that comment. And who's the most guilty of it? I would argue that probably the profession that's most guilty is the medical profession, medical doctors, osteopathic doctors. Why? Because they don't get any training in it. But so it's almost like, I don't know, I've said this before, you guys have heard me say this before. Most people go to a medical doctor and think, this guy knows everything, or this gal knows everything, right? He's been trained, he knows human physiology, he knows anatomy, he knows biochemistry, he knows nutrition. Like if it has to do with my body, he's the expert. And the reality is he's not, because the level of nutritional training that happens in medical school is it's quite scary, really. I mean, happy belated Halloween. It's that scary. You get less than 7 hours of training, and some schools don't even have that, don't even meet that level. There is no great requirement for nutritional training in medical school. So here you have somebody who's not even qualified to make the statement being put on a proverbial pedestal in the eyes of any patient who thinks or assumes that they're qualified to make that statement, but the reality is the patient doesn't know they're not qualified, that the doctor's not qualified to make that statement, so they believe it. And this is part of the problem. You know, the longer we ignore nutrition, you know, the 50,000-pound elephant in the room of chronic disease is bad diet, it's poison in the food supply, and it's sedentary workforce, right? It's the combination of these factors. It's the lack of purpose-driven life for many people. So you have a psychological, you have a spiritual, you have a biochemical, and you have a physical milieu that is not conducive to good health. And no one in the medical establishment, for the most part, if we're talking about mainstream, addresses these issues. That what they address are symptoms with drugs. And again, many people, that's what they want. Some people go to the doctor and they want, give me the pill, fix me, doc. To me, that when somebody says "fix me, doc," that's a statement that how do I want to put this without offending everyone? I'm just going to say it. It's a statement that just shows the ignorance of the person saying it, because it's not the doctor's job to fix you. It's your job to pay enough attention about the physical form, the emotional capacity, and the food that you're putting in, and the chemicals that you're exposing yourself to. It's your job to pay attention to those things and make sure that you're not screwing yourself up. It's not somebody else's responsibility. You have to understand, just like you don't want to be responsible for anyone else's choices, that doctor is not going to want to be responsible for yours. And so they're not going to fix you. They're going to give you a false sense of security by suppressing the symptoms that you're experiencing. That's all they're capable of doing, because that's what medicine is. It's symptomatic suppression with artificial manipulation of chemistry without understanding the underlying reason as to why the abnormality exists in the first place. And if you're happy with that philosophy, keep going. If you're not happy with that philosophy, you know, you've got to find a different professional to help you. And that's generally where a lot of people end up with autoimmunity, is that they go through that gambit, that 10-year gambit of multiple specialists, multiple medications, and when they get to the end of that road and realize that there were no answers and there was no real meaningful help or empathy, then they walk away from that system, and now they understand just how corrupt and broken it actually is. But the average person doesn't understand that, and I think that's the real battle that we're fighting in our industrialized countries today is just the ignorance of the masses not understanding true health. They don't teach it in school, and I don't use ignorance as a really even a negative term. They're just ignorant because nobody taught them. Their parents aren't teaching them. The schools aren't teaching them. The doctors sure as hell aren't teaching them. And so you guys all end up on YouTube or Facebook trying to find answers. And doctors like myself and others, there are others like me that are out there trying to do their best to educate as well. And I think at the end of the day, if our movement gets stronger and we can spread this information further and wider, I think then we can create a movement of change. But we're never going to get rid of that old system, because there will always be ignorant people that are willing to put their money into that system. And there's so much corruption at this point now. There's government policy that actually guarantees that system has business for the rest of its days. I mean, that's what vaccine mandates are, and that's what Medicare and socialized medicine are. It's guaranteeing that a completely broken and corrupt system will continue to have business funded by taxpayer dollars as a right to health care. But what you don't realize is nobody has a right to health care, but everybody does have the obligation to take care of themselves. And I think if you make that switch in your own mind, then you won't have to rely on that system. Because to me, in my opinion, anybody who's relying on that system, I feel sorry for them. I feel sorry because I know they're ignorant, because they wouldn't be relying on that system if they weren't. And number two, because they're not really being served at a high level, right? They're being given a false sense of security, and their bodies are going to continue to deteriorate because nobody's teaching them why their bodies started to deteriorate in the first place. Anyway, rant over. Let's see, go down more. I think we're on that feed there. And then let me come over to Facebook. So Faith is asking about MTHFR gene. What specialist should I see? There's no specialist that you need to see if you have a genetic MTHFR mutation or SNP. I mean, that doesn't really mean a whole lot. I think people way overblow the MTHFR mutations. The key with MTHFR, which those of you that don't know, it's a genetic variant that some people have, and it stands for methyl tetrahydrofolate reductase. It's an enzyme that helps us to basically activate folate, and folate's very important in methylation, which is a form of detoxification, but also important in the production of neurotransmitters like serotonin. And so if you have that mutation, it doesn't mean that your body's broken. It just means that if you subject yourself to more environmental and food-based poisons, you have a disadvantage to deal and cope with those poisons because of that mutation. And so the answer isn't to take a bunch of pills to basically affect that mutation. The answer is to address your environment and address your diet so the mutation becomes irrelevant. There you go. You just saw the specialist. Go back up just a little bit. I love this comment. So received ultra pure protein vanilla, makes the best protein shake I have ever had. Yum. Thanks for that, Royal. I agree. It's like, man, to me, I don't know, I don't eat cake anymore, but when I was a kid, it reminds me of like the way cake mix would taste. So if you were ever a kid and you were waiting for your mom after she baked a cake to hand you like the beater, right, or the spoon so that you could finish it up. That to me is what ultra pure protein vanilla tastes like. Should you take, let's see, Suzette's asking, should you take breaks from supplements, multivitamins, protein powder, omegas, other supplements in general? I think it just depends on why you're taking them. I mean, I don't take a break from supplements, and so what do I take? So here's what I will always take without fail. Period, right? Number one, I will always take a multivitamin. Why? Because the food that we're growing today is being grown in soil that is not as nutrient dense, and regenerative agriculture is not common practice. And so a lot of even your organic foods that are being grown in depleted soils that are not being properly regenerated. And so the nutritional value of those foods is lower. That's why I take a multivitamin, and think of it as nutrient insurance for the neglect from farmers. Right? Now, don't get me wrong, there's a lot of great farmers out there doing it right too. And if you live on a farm or you're eating all of your own homegrown food from a regenerative agricultural perspective, you're probably okay to not worry about that multivitamin. But 99% of people don't do that. The other one I would take, or that I do take, is an omega-3 supplement that's concentrated EPA, DHA. And the reason why is the diet itself. We look historically at humans, the ratio of omega-6 to omega-3 should be very close, somewhere to 2 to 1, 6 to 3, and some would argue even 1 to 1. And so what I'm trying to do in my own life is achieve that 2 to 1 at least ratio of 6 to 3, and it's very, very hard to achieve that if you don't love fish. And I don't love fish, so if you're not eating fish 2-3 times a day, cold water fish that is, not like lake or river fish, but cold water fish, which is the richest in EPA, then you're not going to achieve that type of ratio very successfully, or it's just going to be a lot harder. So for me, that's one of the reasons I supplement. As far as protein powders and other things, I think it just depends on what you're doing. If you're trying to get adequate protein in the day, but you find that that the foods that contain that protein, you have a hard time because you get full, and a protein powder helps you achieve that, great. If you're trying to get more protein in because you're working out and you're trying to recover better, I think it just depends on on what we're dealing with. But supplement breaks, I don't take them, but I do change them with time, right? So they do change, and part of the way I change my own is I test myself too. So I run nutritional testing on myself to see, am I lacking something? Is there more of something that I need that I'm not getting from the food that I am eating? And do I need to make a shift in a supplement or an adjustment in a supplement that would help me better take care of myself preventatively? So hopefully that helps you with that question. Can I drink wine with 2 HLA-DQ-B10303 and HLA-DQ-B10601? So what you're saying is you have a DQ3 and you have a DQ1 on your beta-1 gene. So you have your homozygous on your beta-1 gene for non-celiac gluten sensitivity. Does that mean you can't drink wine? No. What it does mean is that you should probably avoid gluten. You'd be best off avoiding gluten. And so what you have to know about wine in that regard is many wines can be cross-contaminated with gluten in a kind of a tricky way. One of the things, they can seal the barrels, the wine barrels can be sealed, and the paste for many of the seals has actually got gluten in it, and so that can actually trickle into the wine. So you've got to be careful with your wine and your wine supplier, and these are just questions you can ask if there's a particular kind of wine you're trying to drink. Now, I personally don't recommend U.S. wines at all. As a matter of fact, most U.S. wine companies are owned by one family, and it's like the Budweiser, it's like the big corporate conglomeration where it's all about profit and not about people. And so I don't really like companies that aren't about people too. I think we should, any company that's making billions of dollars annually should take care of the people that are spending the money with that company. And if you look at most wine in the U.S. is contaminated with glyphosate. They use heavy doses of pesticide. And so that's just not something I care to have. We also use a lot more preservative in our wine here than the Europeans do. And so, my advice there, if you're gluten sensitive, but you're trying to find a good wine, look at European options, but just make sure you're not getting a wine that has a cross-contamination issue. Now, all that being said, is alcohol good for you, and is it going to help you recover from years of gluten-induced damage? No, alcohol is a poison. But you get to a point when you do fully heal, when you do fully recover, if you want to imbibe or enjoy an alcoholic beverage here or there, there's nothing wrong with that. Jessica says, I work in a very large building built in the early 60s. There are leaky roofs and mold mildew growth in the building. I called OSHA, but they said there's nothing they can do, not even an inspection. Besides the option of quitting my job, is there anything I can do to get my employer to fix structural issues and mold growth? Probably not. I mean, you could you could make the effort of trying to hire an attorney, but ultimately you have to objectively be able to prove that the building that you're working in is somehow creating a non-safe environment that's making you sick. And there are certainly tests that you can have done that could, that could validate whether or not you were being exposed to mold and mycotoxins, at high levels. And there are doctors that you could see that could help you collect that medical evidence and then maybe present it to your employer. And, and if they're nice, reasonable people, they may look at that. But if it's a big company, you may or you may not get anywhere. I don't want to speak for what they would or wouldn't do. You might also talk to other employees that work with you and, kind of get a consensus of if anyone else is having a health issue. Because together, if you are all suffering, right, then you may have a better effect, or you may be able to, move a mountain together as opposed to trying to do it yourself. I can speak. One year there was a school that had in the greater Houston area that had a major mold problem, and one of my patients was a teacher, and in every summer vacation she'd recover, she'd go into remission, and then when school started back up and she'd go back into the school, she'd have flares of rheumatoid arthritis. And so ultimately we figured out it was the mold in the school, and when we actually had somebody go in and look, there was a few inches of mold carpet growing on top of the ceiling tiles above her desk and in her classroom. And so then, we contacted the school and they refused to do anything about it. So then what we ended up doing is we called Fox News, and I knew a reporter at Fox, and we got her to do a story. And then shortly after that story was done, the school still refused to comment, but the school got torn down a few months later. So I know we had an impact in that case. So sometimes, if that story helps you kind of think of some ideas that maybe you could do, not that you want your employer to tear the building down per se, but if the problem is severe enough, that may be what's best, for everyone. Because if all the employees are molded or are sick from mold and they can't function, and how effective is that company going to grow and achieve its bottom line goals? Companies are in business to earn a profit, and if all their employees are sick and calling in, and because of the standards of work, then again, you just have to take that and see what you can do with it. Can I still have coffee and carbs if I take vitamin B1 supplements and I eat B1 foods? Yeah, why wouldn't you be able to? Coffee and carbs can deplete vitamin B1, but not in reasonable amounts. I'm not talking about, like a cup of coffee a day is not going to cause severe thiamine deficiency. And just generally some regular carbohydrate in your diet. Where you get in trouble is processed carbs. And if you're that person drinking, multitudes of coffee, like, there's always that one person that they drink a pot in the morning, a whole pot, right? Not one glass, but a whole pot. And a pot in the afternoon to stimulate them into function. That's when you get into trouble. My B12 and ferritin are elevated. Again, B12 elevation, I wouldn't even look at as a potential for, you're probably supplementing with a B12, but if your ferritin's elevated, you should know that ferritin is an acute phase reactant protein released by the liver. It's generally an indicator of liver damage, and so there's something either environmentally or in your food that could be triggering struggling within your liver itself. And so some of the biggest reasons I'll see ferritin elevated is, number one, is a gluten issue, and number two is environmental mold that a person's being exposed to, damaging their liver. Any supplements to help sciatic nerve pain? Probably one of the best things you can use. We have something called Ultra Hemp, and it's got CBD in it. And CBD works really, really well in people that have nerve pain issues. So that would be one. Another would be just if you're not taking Bonnie, a good B complex to help support nerve function. But I would also, you got to go back into why you have sciatica, because sciatica is typically either a piriformis syndrome problem where your piriformis muscle is in spasm, chronically pushing and putting pressure on the sciatic nerve, creating that neuropathy, or it can be a herniated disc where you have disc protrusion pushing into the nerve root, leading to sciatic-like pain. And sometimes it can also be you have to have this ruled out by somebody who knows what they're doing, but there's another condition called lumbar facet syndrome, which can sometimes mimic sciatica. And so I would get with somebody like a good chiropractor would probably be a good person to go and get a good diagnosis from as to why the sciatica exists and get that part taken care of. And you can use those supplements as kind of support, but ultimately you want to know why the sciatica exists. Let's scroll down to Monica there. Monica's asking, do you have any suggestions for a person you suspect has celiac disease and has a lot of psychological and mental symptoms like depression and anxiety? Yeah, number one, get tested. Monica, if you suspect that you have a problem with gluten, get a genetic test done. That'll help you to confirm whether or not gluten may be playing a role in that. Let's put a link up to genetic testing for her. You can ask your doctor to run it, but a lot of times they only run it partially. They're only looking for celiac genetic alleles, and they're not looking for what are called the non-celiac gluten-sensitive alleles. And so, you can ask your doctor to do it, but you want to have that conversation. Otherwise, you can use the link that we put up to get it done. But as far as the psychological symptoms, mental depression and anxiety, vitamin B12 and sometimes iron, because two of the most common deficiencies caused by gluten are B12 and iron, and deficiencies of both of those nutrients can cause severe depression and anxiety. And so you might benefit from supplementing with those two things. You might also ask to get tested for those to see if you are deficient as well, but those are just simple steps you can take today. What can I take naturally instead of BP meds? It's a tough question because, one, I don't know enough about you, Christine, as far as how high is your blood pressure and, where you're at in terms of your diet and your lifestyle. I would point you to my show on the blood pressure, where we talk about natural solutions for blood pressure, things that you should be doing, because generally speaking, blood pressure is a disease of diet and lifestyle. So it's a disease of choices that you can change and watch your blood pressure come down dramatically. And at that point, as it's coming down, what people do when their blood pressure is coming down because they're making better choices is they work with their doctor to reduce and titrate off of the medications that they're taking to, manipulate it in a downward fashion. So that's really what I would suggest you do. A good test for Lyme, there's several of them. Your traditional Western blot not being really one of the best, but there are a number of other antibody tests that can help pick up Lyme and other tick-based disease disorders. So I would just suggest that you work with an expert in Lyme and do the gambit of testing of the immune system, because again, there are different antibodies, there are different types of things that you can produce beyond the classic Western blot. So Western blot is a good test, let's just say, for acute Lyme disease. If you were just recently bitten by a tick and you're trying to rule out whether or not that's the issue, then a Western blot can be helpful. But if you suspect chronic Lyme disease, where you maybe were bitten years ago, those Western blot tests generally tend to come back negatively. And so you've got to look at some of the other antibodies associated with Lyme to get an accurate representation of whether or not it's the case for you. Immediate effects of B1 deficiency that a person would notice. Probably one of the bigger ones is poor sleep, fatigue, and nervousness, like anxiety, or internal shaking or internal vibrations. These are common symptoms of B1 deficiency that you might be experiencing. And then carbohydrate intolerance. A lot of people with B1 deficiency feel worse when they eat higher carbohydrates in their diet. So those would be things symptomatically you could look for. As far as organ being harmed with a B1 deficiency, two organs that are harmed the most. The first, and one's not really technically an organ as much as it is a system, and it's your nervous system, but the other is your heart. Let's see here. Can you recommend a brand for olive oil that you use, please? Off the top of my head, no. I'm picturing the bottle in my mind. I have to get back with you on that one, and I can maybe come back next week with the name of the brand, but I know we use it. It's not a cheap one. I'll have to get back with you on that. Can you feel biting sensation when killing parasites? Define biting sensation. Are you talking about like a tingling or like a like a pinpoint pricking sensation, and where are you feeling it? Let's see, this may not be relevant. Yolette is asking, she's got the flu with high fever and aches and chills. Is there anything I can take or do to relieve these symptoms instead of Advil or Tylenol? I mean, one of the things I like in that situation that I use at home, Yolette, is something called White Willow Complex. Maybe we can put a link up for her there. It's basically a mixture of white willow and boswellia, which have very strong anti-inflammatory effects, but white willow has an antipyretic effect, which means it helps to reduce fever and reduce aches and pains. And so you might give that a shot and see if that works for you, because a lot of the ibuprofen and Tylenol, you got to be real careful if you're gluten sensitive, because most of those products have corn-based fillers or other grain-based fillers, besides all the other junk that's in them. And then there's also the risk of the side effects, because with ibuprofen as an example, it damages the GI tract. Less so in short-term dose use, but more so in chronic use. So Royal's asking about NAC. Being allergic to sulfa, I've heard different thoughts on the safety of NAC. So sulfa and NAC are not the same thing, and a lot of people react to sulfa drugs but do fine with NAC. I'd say if you're really concerned, one, talk with your doctor, but two, if you're going to attempt NAC, if you're concerned, take it in super low dose, and then just kind of wean up a little bit and see if it's something that you feel poorly with. But as a general rule of thumb, I've not yet met a person, even with sulfa drug reactions, react to NAC. So that's just not something I've seen in my own experience. I would argue that it doesn't all come down to liver toxicity, and Jacqueline, it doesn't at all come down to liver toxicity. It comes down to universal poisoning of the body. If we're trying to summarize disease as a whole, it doesn't come down to liver toxicity. It comes down to, if we're talking about liver toxicity, it comes down to what's creating the liver toxicity in the first place. And so, again, that's where intelligent thought and testing can be a very effective way at helping to discover that. Is it okay to take charcoal and activated charcoal and zeolite together? Christine's asking. Yes, actually have something called Mycobinder Plus. It has both of those in it together on purpose, so definitely safe to take them together. Would you get all that rhetoric off of there for me? Okay. What's your take on biologics for RA? I can't seem to get it back under control with diet. You're missing something. If you need biologics to control the RA, then there's a trigger that you haven't quite identified. So if you have dialed your diet in, if you're following no grain, no pain, and you're still struggling, you're probably missing something. It could be an environmental chemical. It could be something like environmental mold. I mean, there are a number of other different types of triggers that it could be, and I would suggest you work with somebody to help figure what those are out. Okay, what time is it? 1:35. Looks like we got more questions than time to answer. Let's see here. Anything else B1 related? Oh, I like the comment. Vladimir says, B1 saved my life. Had beriberi for 3 years without knowing it. I'm glad that you were able to discover that, Vlad. Okay. More on B1. Oh, there we go. Hello, I still have my gallbladder but suffer from gallstones. Would B1 or B complex assist in reducing the gallstones? Probably not. You probably have gallstones for a different reason. Generally speaking, look to taurine, look to vitamin C with gallstones, but also look to what you may be eating or what you may be being exposed to that's affecting your liver's ability to properly produce bile, because gallstones are precipitated bile that crystallize in the gall duct, and that is what creates that as an issue. So generally speaking, there's a trigger, but those nutrients are very helpful in the proper production of bile. Tips for increasing intrinsic factor. You don't necessarily need to increase your intrinsic factor. You need to make sure you stop damaging your stomach. So if your stomach is being damaged by foods or other environmental chemicals, and your parietal cells are being damaged, that's what's going to lower your intrinsic factor. So you have to make sure that you understand if there's anything doing that, you got to remove it, and then your body will take on and heal itself, and then you'll be able to make intrinsic factor without an issue. Is benfotiamine harder to absorb for those with fatty, sluggish liver, or better? Which form B1 is best? I like benfotiamine when we have a neurological issue around B1 deficiency, but you can also use thiamine HCl or thiamine hydrochloride. I mean, it's a water-soluble version. It's, you have to dose it at higher amounts to be as effective as benfotiamine. So you could use a mix, but again, neurologically speaking, benfotiamine would be what I would recommend. Specific diet for beriberi? Yeah, no grain, no pain. No grain, no pain, because most of the causes of beriberi is high carbohydrate, in my opinion. I mean, the world is carbohydrate toxic, and all these processed foods where they have to add B1 back in, synthetic B1 back in, are still not adequate, and they are basically a driver for that. And then you throw on a few medicines that deplete it, and you have the perfect storm. Okay, I think we got to wrap it up. Maybe one more. Burning mouth syndrome. If you've got burning mouth syndrome, in my experience, you've got one of three things. You've got B vitamin deficiency, you've got heavy metal toxicity, or you've got mold exposure in your environment. Those are the three big that I see on a regular basis that can create that burning mouth issue. Okay. We'll come back next week with your questions. I know we didn't get them all answered, but just run out of time. And so every Thursday, 12:30 p.m. Central Standard Time, you're always welcome to come back and chime in and pipe in your toughest questions for me. We'll do our best to get them answered. Make sure also you join us on Tuesday evenings at 6 p.m. for Dr. Osborne's Zone, where we have a full show lined up for you on various health topics. And make sure as well you visit our sponsor, Gluten Free Society. Don't forget to take advantage of that sale, especially if you're trying to prep for Thanksgiving and you're looking for great ideas for the holiday season. We've got some recipes down below in the comment section for you. And use promo code THANKS to save big time on Warrior Bread. Until next week, hopefully you have a fantastic weekend. Don't forget to share. Don't forget to comment. Don't forget to like. Take care. Part of our mission at Gluten Free Society is to create and provide healthy resources for those with celiac disease and gluten sensitivity. Keyword, healthy resource, right? What makes Warrior Bread different from other gluten-free breads? For one, it tastes fantastic. No cardboard texture, no sharpness cutting the roof of your mouth. Warrior Bread has the perfect texture and consistency. But don't take my word for it. Check out some of our customer reviews. Warrior Bread is gluten-free, grain-free, keto-friendly, and paleo-friendly. It is nutrient-dense, organic, and it only has 6 hand-selected ingredients. It is easy to make and requires minimal kitchen time. And to prevent the risk of cross-contamination, this mix is produced in a certified gluten-free as well as peanut-free facility. And because I wanted to make it even better, I hired a professional chef to create more ways for you to enjoy it. Not only can you make fantastic gluten-free bread, when you buy Warrior Bread Mix, I will send you the recipes to make lemon bars, pizza, eggs Benedict, chocolate cake, cinnamon rolls, chicken and dumplings, and much, much more. Why are other gluten-free bread a bad idea? These companies in the gluten-free food industry have a dark secret they will never tell you about. 92% of gluten-free diets fail to result in improvement of inflammation. Why? The gluten-free bread industry uses grains like corn and rice, GMO ingredients, preservatives, and fillers that researchers are finding prevent recovery in those with celiac disease and gluten sensitivity. That's why I developed Warrior Bread. Unlike other gluten-free products, Warrior Bread contains absolutely zero pesticide-loaded grains, no corn, no rice, no sorghum, millet, or oats that have been doused with pesticides and synthetic fertilizers. It's 100% grain-free, 100% GMO-free. There are no fillers, toxic gums, preservatives, or processed sugars. Warrior Bread contains organic ingredients to include blanched almond flour, coconut flour, psyllium husk, sweet potato, baking soda, and sea salt. Look, bread is back, baby, so if you miss bread on your gluten-free diet, grab your Warrior Bread Mix today.